Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how you can stop carpal tunnel pain. And a lot of these techniques actually can be used at home to treat yourself. So before we do that, we need to understand what is carpal tunnel, the causes, the symptoms, because when we do understand that, the treatment is gonna make a lot of sense. So make sure you watch this video to the end to really understand how you can treat yourself. So first, what is carpal tunnel? So we have the carpal tunnel that's actually protect the median nerve. That's the nerve that going up to the hand to supply the hand sensation and feeling and actually some movement. So the carpal tunnel protect the median nerve, and you can see the median nerve here. It's actually the yellow circle here. That's the median nerve. So the carpal tunnel protect the median nerve and flexor tendons that bend the fingers. So it's all going through the tunnel here. So the roof of the tunnel is actually a very strong band of connective tissue. It's called transverse carpal ligament, and this is actually the transverse carpal ligament, actually the white ligament on the top here. So you start to have symptoms because you start to have some pressure on the carpal tunnel that pushing on the nervous, on the median nerve, and that's what causes symptoms. So this area, you really don't have a lot of room for pressure or scar tissue or inflammation or any like 1 to 2 millimeters of pressure or inflammation or scar tissue that will compress on the nerve, the median nerve, and that when that happens, you will start to have symptoms of the carpal tunnel. So when you start to have symptoms, the symptoms like numbness, tingling, and it's very typical. You will feel it in the first three fingers on the front and in the back on the top of those three fingers. So the symptoms: tingling, burning, numbness, pain. Some people can start to feel like weaknesses in their hand and dropping objects due to weaknesses in their muscles. So the risk factors for carpal tunnel, one of the major one is diabetic, rheumatoid arthritis, hormonal imbalance. Actually, it's common with pregnancy because it's changing the hormone and start to have women sometimes start to have swelling in the carpal tunnel and that compress on the nerve. It could happen with the menopause. If someone has thyroid gland issue or imbalance, that actually causes internal inflammation in the body, and the body is slow to heal and swelling. And when you start to have swelling here, we don't have enough room actually for swelling to compress on the median nerve, and you start to have issue with that. One of the common thing is repetitive activities, like if someone really doing a lot of texting and holding their phone, or doing typing, or doing some repetitive motion that require flexion and extension in wrist area, that repetitive motion gonna cause more inflammation, scar tissue internally, and compress on the carpal tunnel. Another risk factor is obesity, and a very rare, it's not very common, is hereditary, which is like genetically you're susceptible for that. But it's the more common ones are repetitive activities and list on the top here because the body is slow to heal. So one of the most important questions is how to treat the carpal tunnel. In order for me to answer this question, we really need to understand the normal healing process. So when you injure yourself, where your body's stuck in that healing process, when we understand that, the treatment will make a lot of sense, and we're actually going to get to the root cause of the problem. If we don't have a good understanding of normal healing, you will not be able to treat it. You're just gonna mask the symptoms. So normal healing, and I'm gonna use external paper cut here for visualization, but the same process happened internally in the carpal tunnel area and compressing on the carpal nerve, the median nerve. So the first stage of healing, with external paper cut or carpal tunnel inflammation, as you can see here in the image, swelling, redness, the blood start to rush to that area, and you start to experience pain and decreased function. With the carpal tunnel, when that pressure occur from the swelling, you probably will experience tingling, numbness, and funny sensation. But when you have more swelling, more pressure, that will compress on the nerve more and actually going to cause a lot of weaknesses. That's why some people actually drop objects when you hold the cup or anything, because your muscle extremely weak. So the second stage of healing is the proliferation stage. That's when the body starts to build the scar tissue. Actually, if our body does not build the scar tissue in the second stage, it's open wound susceptible for infection. So actually, scar tissue very essential for our survival. We have to have that. So internally in the carpal area, when you start to have inflammation, your body start to, and micro tear in the tissue, your body start to build the scar tissue to heal that tear. The scar tissue, it's like a glue that glue tissue that's injured. The problem is we don't have enough room for scar tissue. We don't have enough room in this area for inflammation. And when that happens, that compress on the median nerve and you start to have symptoms. It's a 1 to 2 millimeters of inflammation or scar tissue here. That could be significantly causing a lot of symptoms and weakness. So last stage of healing is a maturation. That's when the body starts to actually clear up everything. In the proliferation stage, the scar tissue, the fascia restriction, the muscle spasm, and trigger points, and the swelling start to decrease. That could take days, weeks, months, or years. As we get older, this speed of the healing process decreases significantly. So I'm gonna use scar tissue as an example how significant the effect of the scar tissue or the swelling on the body. So our muscle should act like a rubber band. So when it contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. And the same process happened with the fascia restriction, muscle spasm, and trigger point. So when that happens, you have a scar tissue that compressing on ligament and tendon, that actually will limit the range of motion of your muscle to contract and stretch, and also going to compress on the median nerve and your wrist. So if someone has a chronic inflammation or chronic carpal tunnel, usually you're going back and forth between inflammation and proliferation. And that's a very typical with someone like have a lot of risk factors. They did the repetitive motion, injured themselves, and they diabetic of having like rheumatoid arthritis or hormonal imbalance or any any of the combination of this list. Because when you start to have those combination, your body normal speed for healing decrease significantly. Okay, so what is the treatment? I'm gonna go over what does not work initially based on the normal healing cycle so you don't waste your time and money on it. Okay, so first thing, it's very common to use like heat and ice. And based on a study, is ice actually temporary relief for inflammation, just half an hour to an hour. It does not really do anything to inflammation long term or proliferation to break scar tissue, release fascia restriction, and so on in this list. Second thing, electric stimulation. It's very common to use in physical therapy, chiropractor, in different settings. But based on a study, it provides temporary pain relief, just half an hour to an hour. But nothing happened here in this list. Did not address anything did not address anything in the proliferation stage or the inflammation stage. It's just temporary pain relief. So next is foam roller. If you keep rubbing it on the top, it's already inflamed. So if you rub over inflamed area, you're gonna inflame it more. So if you have open wound and you keep rubbing it, that's gonna inflame more, it will swell more, actually gonna cause more symptoms. And the foam roller is not gonna go deep to decrease or break down deep scar tissue. So that doesn't work, and based on a study, does not even provide long-term effect. It's just temporary. Massage is the same thing. Manually impossible to really break deep scar tissue with the massage. That's why I have tools that actually can go deeper to do that. And actually, if you have inflammation, and rubbing gonna cause more inflammation. Stretching, if you keep it stretched, think about this way: if you have a micro tear or inflammation and you keep stretched, you're gonna cause more inflammation. Actually, study shows that stretching causes more inflammation. Overstretching could be harmful. That's why I actually don't give my patient any stretching, because there is more harm from the stretching than benefit. And feel free to check other video I have why you should not stretch. Strengthening exercises, we want to introduce it, but if you introduce it in inflamed stage, you're actually going to cause more inflammation. Excuse me. So all of these that you're probably aware of, a lot of these that actually used for treatment, and that's what we learn in the school to treat with the carpal tunnel. But we need to really get the root cause of the problem. To do that is actually we need to go back to the healing cycle, and each stage we need to figure out how to address that stage. So first stage is inflammation. What we can do to decrease inflammation, one is stop the repetitive motion that actually you've been doing that causing the carpal tunnel. If you do a lot of typing, if you do a lot of like hitting a hammer or some kind of like activity require flexion extension in your carpal, take it easy. You need to take a break to really decrease the inflammation. If you are in acute inflammation stage, just rest to 3 to 5 days and it should be resolving. And you really don't need to do a lot of intervention with that. But if the rest for 3 to 5 days has not been improving the symptoms, that's a sign that you're actually going back and forth between inflammation and proliferation, like this image here. So the next thing I do, we need internally to decrease the inflammation. So that's what I use the MagnaHeal 2. It's actually the range of the magnetic field is about 3 inches. So it's actually can penetrate deep in tissue. So that's personally what I used if you have internal inflammation, and I give it to patient. So for inflammation, I use that, and they can wear it at night during the day to decrease inflammation. If it's mild to moderate inflammation, it should take a few days with the MagnaHeal to decrease the inflammation. But remember, when you have severe inflammation like this, we have to work on inflammation and proliferation at the same time. And I will go over what we can do for the proliferation in the next few slides. So the other thing we have to be aware of is I usually will give my patient anti-inflammatory diet, because a lot of food could cause internal inflammation. Like for example, refined carb, refined sugar. Based on the studies, when you eat refined carb, refined sugar, it puts your entire body in inflammation stage for 5 hours. So if you eat that 3 times a day, your body in internal inflammation for 15 hours a day. And that will slow down your healing. So if you're internally in inflammation, you're really in that vicious cycle of inflammation proliferation. Your body will not gonna heal even if you stop the repetitive motion in here. So we have to do the anti-inflammatory diet. I will cover some of that in other videos, but that's very part of addressing the inflammation. The other thing, and when you look at this restore deficiency, because it's very common when you're stuck between inflammation and proliferation going back and forth like that, your body does not heal because you're missing essential nutrients for your body to transition from inflammation to proliferation to maturation. For example, you need magnesium, you need D, you need zinc, you need C, you need B for your body to go from inflammation to proliferation to maturation. If you have vitamins, mineral deficiency, hormonal imbalance, and when you look here at the risk factors, they all hormonal imbalance. If you have hormonal imbalance, your body gonna be slow to heal. So for chronic condition, we have to figure out what is missing, what is deficient that slow down your healing. And when we do that, the body actually get the nutrients that needed to transition from inflammation to proliferation to maturation. So how you do that at home? Well, the good news, you can take advantage of Ask ASTR. That's a free online medical evaluation. It takes about 5 minutes, and the software will help you to figure out possible deficiency you might have and what you need to do next. The software is include 9 healthcare provider database. Is extremely comprehensive, evaluating your nutrition, your nervous system, your cardiovascular diseases. It's a very comprehensive evaluation, and with that, that will give you a tool to really figure out what to do if you really stuck in between inflammation and proliferation. You really need to get to the root cause of the problem, because if you have for example, if you have magnesium deficiency, MagnaHeal will not replace magnesium. Your diet will not meet that deficiency, because if you have deficiency, you need to have higher dosage. And check out the why you might have magnesium deficiency video I have to know if you might have magnesium deficiency or not. But there is other vitamins and minerals could be involved in slowing down your healing. So the second thing we need to work on is a proliferation stage. As we see here, the proliferation stage, it's including the scar tissue, fascia restriction, muscle spasm, trigger point. We have to work on all of these simultaneously, because when you start to have carpal tunnel, you start to have a scar tissue there, and the fascia start to restrict, you start to have muscle spasm, you start to have trigger point. It's like all happen simultaneously. You cannot pick and choose what to work on. So the first thing I will work on is the scar tissue and fascia and the trigger points. And I use in the home self-treatment program for patients, I go over when to do that in relation with the inflammation, because we have to be sensitive with the inflammation. So I use the A3 to break external scar tissue around this area and release the entire muscle and tendon from the insertion, from origin to insertion. And we work on the carpal tunnel area to decrease the pressure of the tissue, of the scar tissue. For deep scar tissue, I actually go deep with the A5. This is what I use to break deep scar tissue and trigger points. That the A5 can go deep as far as 2 inches even. So we use that for the carpal tunnel and around the tunnel to release any deep scar tissue, break it down. So, and the other thing we need to work on in the proliferation stage is the fascia release. I will go briefly over the fascia system, but I have another video on it. And why I'm covering this here briefly, because I want to make sure that you guys are aware of the significant influence of the fascia system, because it's overlooked by healthcare providers, and it has significant effect on carpal tunnel syndrome. So the fascia system, to make it complex, but it's not very complicated as you think for the treatment, but the system is complex. So we have 2 big categories of fascia. So the superficial layer and the deep layer. The deep layer divided to 4 subcategories layers. And each layer has 2 to 3 sub-layers, and that shows you how complex the system. That's why massage does not work, because it's not going to go deep enough and distinguish between those layers. That's why foam roller doesn't work, because you will impossibly go deep with the foam roller. So the first layer of fascia, the superficial layer, it's like a wraps around in the entire body. It's like a Spider-Man suit. Very thin layer wrapping the entire body. So when you have restriction in the fascia, it's like you have you're wearing a t-shirt 2 to 3 sizes too small. It's gonna limit your range of motion and compress on everything. And when your fascia is tight, this is what's gonna do: suffocate the tissue underneath it. It's squeezing everything underneath it. And this is very common to happen after inflammation. It feels like pressure, it feels like a band compressing on everything. And that band, actually, we have a fascia layer around the nerve itself, the median nerve. And when that's tight, it's actually squeezing on the nerve, and we need to release that. So the aparatic fascia, it's wrapping a group of muscles, and you have the epimysin wrapping in each individual muscle, and you have the premiysin wrapping a group of fiber, and you can see it in this image here. So when you look in this image, you will see the epimyosin wrapping the entire muscle, and then you have the premiyosin wrapping a bundle of muscles here, and each individual fiber actually has a wrap of fascia layer, and your nerve is actually wrapped with a fascia layer. Why I'm going over this? Because if your treatment does not address all of these layers, you basically not treating carpal tunnel. We need to release the superficial layer of the fascia, the deep layer, and the very, very deep layer, because those layers, if you don't have mechanical force with tool to really go deep to release it, it's not gonna release by itself. Okay, so what we do to release the fascia layer. So what I do is I use the A1 to release deep and superficial layer, as you can see it here, sorry. You see it here, release the deep, the superficial layer of the carpal of the fascia. Then I use the A5 to release the epimyosin, premiyosin, and endomyosin. So to sum it up, you need to first of all stop the repetitive motion that actually cause the trigger. So if you do a lot of repetitive motion, you need to take a break, because that's gonna cause more inflammation. If you are in acute stage, 3 to 5 days, that should be good enough to get you back to normal, or a week max. If you have a chronic inflammation and you're going back and forth between inflammation and proliferation like this, you need to be aggressive to address the inflammation stage with the diet, with restoring deficiency using the Magna Heal, and I have linked below for how to get those tools to do it on yourself at home. And if you are a healthcare provider, you can actually get those to treat your patient with it. So we need to really decrease the inflammation, Magna Heal, restore the diet with the anti-inflammatory diet, and actually meet deficiency. And simultaneously, you need to break the scar tissue, working on a proliferation state. Break the scar tissue, release the fascial restriction, muscle spasm, and trigger point. So I hope this video helpful, and if you have any question, comment, make sure you type it down in the comment section below. Sure. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.